very interesting and very important Dye-George syndrome, which is very important topic for your immunology, for your congenital heart disease in your Harrison, this all. Yes, how can you remember this Dye-George syndrome? As the terminology is saying, dye means 2, so yes, 2, but 2 times 2 means 22. So MCQ, it occurs due to the mutation in the 22 number chromosome. More detail you will see in your clinical, but yes, with the terminology dye, you can remember the 2. How many times 2? 2 times 2. Dye-George syndrome, it occurs due to the abnormality in the 22 number chromosome. Yes, it is also known as the velocardiofacial syndrome. According to the name, you can see, yes, it is having the defect in the heart as well as the face. It is also known as the Sprengen syndrome. Now see what is happening. Here is the image of the baby presenting with the Dye-George syndrome. Yes, can you see? The baby is presenting with the small mouth. Can you see? The baby is presenting with the smooth philtrum. Very slopy, very smooth philtrum. Okay. Now another feature, can you see? Micrognathia. Yes, these patients are having the very small jaw. Okay. Now prominent nasal bridge. When you will see from the lateral aspect, they are having the elevated nasal bridge and posteriorly rotated ear. Can you see? The ear of the baby is comparatively on the posterior side. Okay. So these are the various features of the Dye-George syndrome. Again, we are going to correlate with other clinical. Yes, like the first arch syndrome. We are going to talk about the first arch syndrome. Okay. So yes, first arch, do you remember the first arch was responsible for the formation of the mandible. Later in the development of the face, we will see it also forms the maxilla and the palate part. Okay. So few patients are there in which there is the abnormal first arch development. Now see, I told you that according to the recent updates, the neural crest cells are making this nearby structure. Yes, this maxilla, mandible, all the facial skeletal mainly created by the neural crest cells. Suppose the neural crest cells are unable to migrate from the neural part, from their origin site to the pharyngeal apparatus. So this will not create the structure getting developed by the neural crest cells within the pharyngeal apparatus. So this patient will present with the small maxilla, small mandible, this all. So these are known as mainly 2 types of the syndrome: Treacher Collins syndrome and Pierre-Robin syndrome. Okay. So first of all, we are going to talk about the Treacher Collins syndrome. Yes, can you see Treacher? Can you remove this R? If you are removing the R, then it becomes the teacher. Yes, do you remember the Teacher's Day is celebrated on the 5th September. So you can remember that Treacher Collins syndrome is due to the abnormality in 5th chromosome. Okay. Now see what are the presentation, because it occurs due to the first arch defect, and first arch mainly makes the mandible. So these patients are having the small jaw, mandibular hypoplasia. Okay. Other features you will see in your ENT and in your clinical also, but this is the fact which you can retain in your brain and you can correlate with the anatomy. Now see here, there is another syndrome given in your standard embryology book, that is the golden heart syndrome. Now see, it is also known as the auriculovertebral spectrum. Oculo means this patient will present with the eye deformity. Yes, auriculo means this patient will present with the ear deformity, eye deformity, ear deformity, and also vertebral spectrum. That's why these patients are presenting with the abnormal vertebral column presentation. See here, because this is the first arch related syndrome, that's why the first arch derivative, yes, like the maxilla, mandible and other temporal zygomatic bones are also very small or flat. You can see this image. Okay. Now see here, these are presenting with the eye deformity, like the tumor may be there and dermoids of the eyeball may present. Okay. Now ear deformity, yes, they may present with the anotia. Can you see ear deformity here? Yes, anotia or microtia, small ear. Okay. That's why it is the auriculo and vertebral, because they are presenting with the fused hemivertebra, or yes, they are presenting with the spina bifida vertebral abnormality. So this is another clinical correlation of the anatomy embryology with your Harrison, with your ENT surgery part. Okay. Now there are the few other syndrome like first arch syndrome, one more syndrome, that is the Pierre-Robin syndrome. Yes, Pierre-Robin, just one funny correlation, Robins. We are studying the Robins at the age of the 17 year. Yes, just to remember, near about the 17 year we are studying the pathology or the Robins. So 17 number chromosome is the it is related with the Pierre-Robin syndrome. Yes, it is presenting with the three main symptom. GCR is the trip. Yes, girls common room. At the age of the 17 year we are studying the Robins, where at the girls common room. Just one funny story. So yes, what is this GCR? Glossoptosis, abnormal development of the gloss means tongue. Can you break the name? Glosso means tongue, apoptosis means death. So there is a no proper development of the tongue tissue, so the tongue is affected. And C for cleft palate, again do you remember the tongue, palate, they all are developing from the first arch structures. Yes, and the retrognathia, yes, the mandible also develops from the first arch. So these all tongue, palate and the mandible is not properly getting developed by the first arch. So this syndrome is known as the Pierre-Robin sequence or Pierre-Robin syndrome, which occurs due to the mutation in the 17th number chromosome, okay, which presents with the GCR, glossoptosis, cleft palate and retrognathia. Now can you correlate? Yes, this is the another image for your correlation. Yes, here again the few updates for the recent MCQ. Again I am telling you, tonsil, parathyroid gland, thymus, okay, caudal pharyngeal complex, these all are mainly derived by the neural crest cells. Okay, so this is the one update for you. You can see here we have already discussed. Okay, and last, how this topic is important. Always the questions are asked in the recent exam. Again this question has been asked, which of the following muscle develops from the first pharyngeal arch? Okay, do you remember the first pharyngeal arch? It gives rise to the structure near here, and all the structures are here. Yes, bone or the muscles. So do you remember four muscles of mastication and mylohyoid and entry belly of digastric, not the posterior belly. So here definitely your answer is the entry belly of digastric. Posterior belly of digastric, it develops from second arch. Stapes is the bone, skeletal element of the second arch. Stylohyoid, either the ligament or the muscle, both develops from the second arch, skeletal element or the muscular element. So this is all about the pharyngeal apparatus.